Okay. We wanted to notify all our panelists that this discussion will be recorded and shared to our community. By participating in this session, you are giving your consent to be recorded. And again, thank you for being part of today's discussion. We are so grateful for the information you have to share with us. I will ask that you guys go ahead and do a brief introduction. We can go ahead and start with Dr. Mengati.
Good evening, everybody. This is Dr. Mengati, infectious disease specialist at Decatur Memorial Hospital. We've been dealing with COVID-19 cases for the last, for more than a year. So, thank you.
Dr. Surbe?
Hi, I'm Dr. Tricia Serba. I'm a board-certified pediatrician and the medical director for primary care and population health at Crossing Healthcare in Decatur.
Dr. Yaki?
Hi, I'm Sandy Yaki. I'm a pediatrician, board-certified pediatrician like Dr. Serba with SIU School of Medicine doing general pediatrics here in Decatur and in Springfield.
And Dr. Berg.
Hi, I'm Caitlin Berg, also part of SIU Medicine, doing general pediatrics in Decatur as well.
Thank you. I really appreciate that. We're going to go ahead and start answering some questions we've gotten from our community. I will ask that if you're not speaking, if you could mute yourself. That way we don't have an echo. I greatly appreciate that. Oh. Hello, Dr. Patel. Well, we'll go ahead. We'll get started with the first question. Oh, he's coming back. Okay, Dr. Menengati, first question. What should parents and children expect after receiving the vaccine as far as fever and tiredness and things like that?
It's one of the common questions asked because most of the children and the parents are concerned about adverse effects from the COVID-19 vaccine. Basing on the studies that were done by Pfizer, which is a vaccine that's approved for 12 and 15-year-olds, the commonest adverse effects that were reported were usually a pain at the injection site. It looks like universally every a person who had the injection in this age group had it. Approximately about 90% of the children did report injection site pain. And coming down on the list, I mean, about 75% of them had a headache, probably, and about close to about 60% complained of fatigue, weakness. Fever, not a very major proportion, but approximately about 25 to 30% of the vaccinees had reported fevers, and I think chills were probably more common than fever itself in this patient population, about 40-45% of them. And the other things that, but not very common or not very high in the list, are joint pains in about 20% of the patient, swelling of the lymph nodes about less than 1%, some nausea here and there. Muscle pains is another major symptoms that have been reported, about 40% of them. These are, in a nutshell, the adverse effects or the side effects from the vaccine that were reported in the Pfizer trials in 12 to 15-year-olds.
Thank you. Does anyone have anything else they'd like to include with that response? Okay, another question for you, Dr. Menengati. How many patients in the U.S. were studied between the ages of 12 and 15?
Before I get into the crunching the numbers and the data and the studies, I would have really commend the kids and their parents who were bold enough to get into these trials, although these trials were done after the adult population had their trials and approved. In the Pfizer trial for 12 and 15-year-olds, there were about 2,260 kids who were enrolled in the trial. And that's a lot of courage, to get into these trials. And originally, when we were dealing with COVID infections in adult population, there was a thought that, it does not affect the children, we don't have to worry about them. But if you look at the Pediatric Academy data or the CDC data, there have been a significant number of COVID positive cases in this age group. And their onward transmission to the parents or grandparents, which is known. So, and also basing that approximately a little more than 1% of the COVID infections in the age groups required hospitalization. So it's not a not serious problem in this patient population. That's why the need for vaccination.
Thank you. Any other comments to add? And last question.
I just want to make a comment. In less than a week that the vaccine has been approved for the 12 to 15-year-old age group, as of last night, there have been 600,000 vaccine recipients in the entire nation. That's pretty fast.
That's amazing.
Impressive.
Yes. And then last question, is the dose the same for children as it is for adults, and is that safe?
Absolutely, it is the same. They give you about 0.3 ml, 0.3 ml of the vaccine, which translates into about 30 micrograms of the mRNA that we are talking about. And it's the same in the adult population and the kids for 12 to 15-year-olds. And obviously, the efficacy of the vaccine and the adverse effect that we listed just now are pretty much comparable to the adverse effect that we see in adult population. So it is safe and it's efficacious. And to just go dwell into the studies, there have been no cases of COVID. Just let me break the numbers. About 1,129 12 to 15-year-olds had the vaccine, and 1,131 of the group had normal saline, which is considered placebo. Out of this, there are, I think, 14 or 15 infections in the placebo group and 0 infections in the kids who got the vaccine in this Pfizer trial.
Well, thank you very much. I also want to welcome Dr. Patel. Dr. Patel, if you want to introduce yourself. Dr. Patel, you're muted.
Sorry, can you hear me now?
We can, thank you.
All right, sorry again. This is new for me, I apologize. So I'm Dr. Samir Patel, a pediatrician here at St. Mary's Hospital. How's everybody doing? I should greet everybody. Good to see everybody after a long time. I'm a pediatrician currently at HSHS, St. Mary's Hospital in Decatur.
Thank you. And I'm going to go ahead and ask you a couple questions. First one, have there been any results noted with the study done specifically pertaining to children in this age group with asthma or food allergies?
And actually, I don't have any of that specific information on it, but what I can tell you on the studies that were done with the older population, 16 older and adults, that there were children or there were adults and children with asthma and allergies. So I don't know the exact number, but they were included. And when they asked them about their past medical history, they did have, some of them have asthma and allergies.
Thank you. Does anyone else have any information about that? Follow-up question, which studies are indicating the safety of the vaccines, and how are the studies conducted, and how are the studies demonstrating long-term safety given the short period of time the vaccines have been in use?
Well, all I can tell you is all the studies that were done by Pfizer, Moderna, and they're all are the ones that we're talking about the safety of vaccines. So I don't know exactly which studies per name, but they all talk about the safety of vaccines in kids, and especially at this population. And one of the things that we're talking about is the safety and the long-term effect. Well, we know that the studies have just been started, okay? We don't know much about the disease itself. So a lot of parents ask us, if I got the COVID infection, what are my long-term effects? Well, we don't know. We're just learning about COVID as it is. And so we don't have long-term data on the disease itself. And we have just data from the studies that were done. And so we know from last year when they've done these studies, and now we know after 6 months or more, the data shows the vaccines are safe.
Thank you. And then a follow-up question. Do you have any idea when children 11 and younger will be able to get vaccinated?
Yes, I did check on that. And it's interesting enough, they came out yesterday. They're not sure, but they're looking at the timeline for kids younger than 12 to be vaccinated around the fall and the winter of this year. They don't have exact time data yet.
Excellent. I'm sure everyone's excited. And then
Crystal?
the last, yes.
Yeah, just to give you a numbers breakdown, I'm surprised that there have been more people getting enrolled into this between from 6 months to 11 years than what we had from 12 to 15 years. And they expect to have all the data ready by the end of the year for sure.
That is great news. So, Dr. Patel, what is your takeaway comment to parents and children out there who are on the fence about receiving or allowing their children to receive the COVID-19 vaccine?
Well, we answer their concerns first because they're on the fence, but I want to know exactly what are they concerned about? What is their worry? And so they'll bring up some of the side effects and they talk about the studies and I reassure them. And they're also looking for more data. And they ask me about me and my family, of course. And so I have children, but they're older, 20 and 25. And they asked me, did they get vaccinated? I said, yes, they did. And they asked me about the side effects and how did they feel and so on. And I tell them. And we tell them about we ourselves as clinicians have been vaccinated. At least I can tell you for myself. And then they're still looking for information because there's a lot of information out there. And I went online to look at all the videos and so on, and it is overwhelming. And some of the websites out there are confusing, of course, we know that. But there's actually an app out there that I share with my parents and in my office and teenagers that want to know information. The app is called Vaccine on the Go. And I'm not sure if everybody's heard about it. It's from the Children's Hospital of Philadelphia. And so when you get any vaccines, adults or kids, you are actually asked, you're given these handouts about the side effects and the vaccines that's put out by the Children's Hospital of Philadelphia. So what they did is they came up with this app called Vaccine on the Go. When you open it up, it says Vaccine Education Center. And they've actually put in the section called videos. So they have different vaccines, their safety, their immune system, but the video actually talks about all about COVID-19 and the vaccines and the COVID and all the other vaccines that are out there. And in terms of the safety, how they came up with the vaccines, they have these little video tutorials. These videos are 1 minute to 4 minutes, so they're not overwhelming. And they separate from facts to fiction. So I was very happy when I found that, and I share that with my parents, and it really helps them understand it in a simpler way. So, and I tell them that it's very important to vaccinate because the important part we don't realize is we vaccine the children, we vaccine them to protect themselves, their family, and of course the community.
That's a great resource. Can you say what that app is again?
Yeah, it's called Vaccines on the Go, and it's a free app.
Perfect. Thank you so much.
Thank you.
Hey, Dr. Serba, I do have a few questions for you. Are children having reactions to the vaccine similar to adults? And how effective do the vaccines appear to be in teens?
So I think Dr. Menegatti very clearly kind of covered the statistics as far as the most common adverse effects or side effects from the vaccine. And I like to refer to it in that manner. I hesitate to say reaction when I really feel like these are sort of side effects from vaccines. And I also want to point out that these same side effects that Dr. Menegatti referred to and that we're seeing in the studies and in the literature really are the same vaccine side effects that we see in pretty much all vaccines that we give. As pediatricians, we give lots, we give all the vaccines of childhood, we give lots of vaccines to babies, and pretty much every pediatrician or pediatric provider, when they see a patient, an infant, we coach the parent about what to do when the baby gets fever, has fussiness or redness and swelling at the injection site following the vaccine. And it's a pretty anticipated and expected outcome for the first couple of days after the vaccine. And I kind of like to remind people, my patients, that this COVID vaccine is the same vaccine as far as how our bodies sort of adapt and react as far as side effects. So while we expect, our infants to have fever, fussiness, redness, and swelling at the injection sites for a couple of days, I think we also should anticipate that with any vaccine. I remind the older kids with the flu shot. I remind the parents, if they're going to get a flu vaccine, you're probably going to have, some side effects after the vaccine. So I kind of like to frame it in that manner to sort of normalize it a little bit, and also remind them that what we're seeing following COVID vaccination is really very similar to what we see following any vaccination. Speaking to the effectiveness of the vaccine, again, kind of to quote what Dr. Menegatti said, but in the Pfizer study for the Pfizer vaccine in the children 12 to 15, the vaccine did prove to be 100% effective in all of those children. So I think I don't know that, well, it can't get any better than that. And if you want proof that something is going to work, there it is right there. So.
Thank you. That is great information. Another question that came through is, what if your child has not gone through puberty yet? Do they know effects on puberty?
So obviously this is not something that can be studied. You can't really do a study to investigate the effects on puberty exactly. Anything with respect to this would be something that you would observe. Now that said, and again, sort of also remembering that the COVID vaccine is at basis a vaccine. So we do know sort of how bodies accept and process vaccines, that there are no vaccines that cause any problems with children's development or growth. So, vaccines as a whole do not have any effect on puberty, and that would also not be expected with the COVID vaccine. When you get down to kind of the science of the vaccine and at the levels of the cells in our body, the COVID vaccine acts as an mRNA vaccine, and that stands for messenger RNA. And basically the messenger RNA are kind of the building blocks of our cells. And the vaccine acts by entering into our cells with the mRNA and then causing an antibody response. And then these mRNA pieces break down very quickly and are sort of swept out of the cells and eliminated. So there really isn't an ongoing effect of the components of the vaccine. And that also would also go along with the idea that this should not and would not cause any problems with growth, because these are not retained products.
Thank you. And then you've kind of touched on this, but can the COVID-19 vaccine alter a child's DNA?
No, it cannot. So it does not contain DNA. As I mentioned before, it contains mRNA, which is different than DNA. DNA resides in the nucleus of every person's cell, of the cells in everybody's body, in the nucleus. And as I just mentioned, the mRNA enters the cell, but it does not enter the nucleus of the cell. So it actually has no contact or no impact whatsoever on anyone's DNA.
Thank you for that.
Sure.
Dr. Yaki, I've got a couple questions I'm going to pass your way here. The first one, how is the vaccine safe when it was developed so quickly? Other vaccines have taken much longer to develop. So is this safe and tested enough with the speed that it was ready? You're still muted.
Got it. I think I got it. Okay. Yeah, I think that's a good question and makes people a little bit, that is one of the hesitancies that people have about using the vaccine. And so I think it's really helpful to understand that they did not skimp on the parts of the process. So they went through all the three phases of the clinical trials, just like they do for other vaccines. It just happened that a lot of the pieces were in place to make this vaccine, I think, go through faster. And some of those pieces were that there was a basic foundation. They already knew some about SARS, SARS illness before with MERS. They've had some coronavirus illnesses that were instructive. So people knew about the coronavirus already. They already had some of the technology for using mRNA, although they weren't using them in vaccines that we used, but they were doing research in that. So that technology already existed. And then there was a lot of interest. So both people interest and money interest in order to help the process go through quickly. So in order to do the clinical trials, they need enough people to sign up for the clinical trials. And that happened really quickly because people were so interested and committed to solving this problem. And then there was a lot of money provided for the research, which I think takes sometimes a long time to fund a project like that. And then after that, there was a lot of disease. So they were able to come to the statistical significance because there was so much disease to see, did the placebo arm operate differently than the vaccine trial arm? So there were just a lot of factors that went into place to make it very quick. And so I think that makes me feel confident about it. I don't think anybody who knows me would call me a trendy person. I don't dress trendy. I'm just, but I got to be part of the 1A group, and I got to be vaccinated very early. And this is the kind of information that gave me the confidence to proceed personally to do it.
Great, thank you. Another question, is there any chance or evidence of individuals becoming sterile or other serious side effects?
Yeah, that seems to be a big question, and there is no evidence for that. The concern about it came from a social media post that someone posted, and then it just kind of went, as things are prone to do in social media, and caused a lot of concern, but there isn't any real evidence that that is the case. And I even saw that, like, the American Society for Reproductive Medicine is saying that's not true, but it's unfortunate that information was spread that way, but it seems to be misinformation that it does not cause problems with fertility and sterility.
Thank you. Dr. Meningatti, I see you have your hand raised.
Yeah, I just researched this particular piece of information this morning because I hear that not only from, I'm not a pediatrician, but most of the young staff in the hospital who are in their 20s, 30s, they're worried about this infertility. Pfizer in their database have made a statement saying there is no association of infertility with the vaccine. There's nothing in the literature search that I did this morning intentionally because this was one of the questions that I knew would come up, and I have not seen one in this regard. So there is no association as far as we know.
Thank you. Great information. And then Dr. Yaki, back to you. Can a child receive a COVID-19 vaccine with other vaccinations?
Yes, and this is something that is a change. When they made the recommendation for children 12 to 15 to get the vaccine, they also made the recommendation that it could be co-administered with other vaccines, which is important because it's an age group that we are trying to vaccinate for middle school and high school vaccines. So that's really good news.
Yes. Are there any limitations to that?
I don't believe so. I think
Dr.
they
Serba?
just said we can co-administer.
Great. Dr. Serba.
Yeah, and I was just to build on that a little bit. You know, when the vaccines were first released back in December, there was, you know, caution to with the advice to not administer the vaccine within 2 weeks before or 2 weeks after another vaccine. And I think it's important to point out that the rationale for that recommendation was not that the COVID vaccine would react with another vaccine, or the previous vaccine would react with the COVID vaccine and make it inactive or somehow cause harm. It was more a view towards monitoring the COVID vaccine and the side effect profile of that. So if you happen to give the COVID vaccine around the same time as you give another vaccine and a patient has a side effect, you don't know which vaccine is causing it. So if you sort of restrict the administration of the vaccine, and so it's the only thing given, then you actually get much better information and much better data on the side effects that may come up.
Great. Dr. Meningati.
On the same token, they said, I mean, if you had to take an emergency vaccine like a tetanus or rabies shots, while you're in the process of getting your COVID vaccine, they didn't see any contraindication to that.
That's great news. And then that's all I have. Dr. Berg, I've got a few questions for you. This one we've already touched on, but another question came in. Can it cause infertility in kids? Is there any statistics about that, or a disclaimer on the vaccine that the effect of fertility is not known?
Yes, so as we have discussed a little bit so far, no, it does not have any effect on fertility. There have been women of childbearing age that have gotten the vaccine during pregnancy, before pregnancy, and it has not had an effect for them at all. And it has the kind of national bodies for obstetrics and gynecology, fertility, and maternal fetal medicine have all still recommended that women in childbearing age get the vaccine. If anything, it could be beneficial. I mean, not that we're encouraging teenage pregnancy or anything, so that's not as an effect for our teens, but for kind of those 18 to whatever childbearing age, that antibodies could be passed through the placenta during breastfeeding or pregnancy or anything like that. So if anything, it's a benefit to the infant itself too.
And that's great news. What about, can the vaccine have an effect on a child's menstrual cycle and the people around them?
No, it does not have any effect that they have seen on menstruation, like we've talked about with puberty and development. The way it works, it should not have any effect on any of that or any person around them at all.
And then the last question, can the vaccine make my child sick with COVID-19?
And that answer as well is no, it cannot give you COVID-19. There are not live parts of the virus or any particles of the virus at all. Like we said, it's the messenger RNA that is kind of the blueprint for our bodies to make these proteins to fight against the virus if we were to be exposed to it. So no, it does not give you COVID-19 to get the vaccination.
Well, I want to thank you guys. Is there any other comments that you would like parents or guardians to know as they're thinking about getting the vaccine for their children, information that maybe we haven't touched on, or questions that you've heard in your office or in the community?
Well, I want to add something that I've been keeping an eye on all these reports and videos that came out. And one of the latest one was a healthcare worker in Florida who was involved with administering the vaccine, taking, COVID testing, and she had the COVID vaccine, and 2 weeks later she got COVID. And one of the biggest things is people are like, well, why did I get COVID if I got the vaccines? And they just don't really understand that. Remember that you can get the flu if you get the flu vaccine. The COVID vaccine's there to keep the symptoms from being more severe, hospitalization, and death. So again, a lot of these things are coming out that also COVID vaccine has killed a lot of people. There's in over 208 million doses worldwide. Nobody has died as a result of the COVID vaccine. So just want to make sure parents understand that, yes, you can get COVID if you get the COVID vaccine, but it's not the severe form. It's not going to make you sick enough that you need to be hospitalized. So I just want to make sure we make that clear, that they understand it. You guys did hear me, right? Am I muted?
I was muted. That was my
okay.
fault. Thank you, Dr. Patel. I really appreciate it. Next, we're going to go over, I have 2 hands raised. We're going to go with Dr. Serba first, if you'd like to add anything.
That would be a technology error. So no, I'm good. Thank you.
Dr. Meningati.
Yeah, as to addendum to what Dr. Patel mentioned, it's you get the COVID, but again, it depends on at what time you got the vaccine. Are you fully vaccinated? I mean, you got to take 2 doses. You got to wait in a couple of weeks after that. So in the interim, I mean, yes, if you're exposed, you may not have a full protection for the vaccine. It does not mean that the COVID vaccine gave you the COVID infection. I mean, we hear that from our patient population when it comes to the flu vaccine. Oh, I got the flu vaccine, and the next morning I got the flu. And so it's just, I mean, it takes time for these vaccines to like. One of the interesting studies that the CDC conducted was about healthcare workers who are high risk for COVID, as we all know, over the last 1 year. They have done about 2,500 patients, healthcare workers, and then they got 2 doses here completely, and then they got only 3 infections in their study. When they got 1 dose out of 500 people, they got only 8 infections. And healthcare workers who were not immunized, close to about 1,000 people, they got about 220 infections. So that tells you how effective this vaccine is in patients who are high risk for these infections. And it also bodes the same for the general population.
Thank you. Any other information you'd like to share with the audience? Okay, well, I just want to tell you guys again how thankful we are to have you guys here answering questions from the community and providing that information. We're so grateful. Thank you guys again.
Thank you very much, Crystal.
You have a good one.
Thank you all for the panel for coming too.
Thank you, guys.
Yeah.
Be safe.
Bye-bye.
Bye-bye.